coming in. Good morning, miss. My name is Darby Lipka. I'm going to be doing a physical assessment on you. Is that all right?
Yes.
Okay, so before I do anything, I'm going to look around the room, making sure my safety precautions are in place, the bed's in the lowest position, and side rails are up. From here, I'm going to perform hand hygiene. I'm going to come over. I'm going to grab her wristband. Can I see your wrist real quick? Can you give me your name?
Astrid Tippenower.
Your date of birth?
07/23/98.
Okay, and do you have any allergies I need to know of?
No.
Okay. You know where you're at right now? Specifically where?
Broward College. Hospital.
Okay, and do you know what date or year it is?
2020.
And do you know who the president is?
Joe
President-elect.
Biden.
Okay. From here, I'm gonna ask about your pain. On a scale from 0 to 10, 0 being no pain, 10 being the worst pain. It's be 0.
Mm-hmm.
Okay. And then we'll begin with the inspection. So I will grab some gloves, put them on. I'm gonna be checking her scalp real quick. So I will be going around, touching your head, making sure that there's no lumps, lesions, any bruising or bleeding anywhere. The head is normal cephalic, which it is. So my findings for that would be normal cephalic head, no abnormalities associated with the skull. And we would begin our cranial nerve assessment. So I'll be taking my gloves, tossing them out, doing hand hygiene, moving on to cranial nerve 1, olfactory. So from here, I'm gonna grab my pen light. Can you put your head up for me real quick? Expanding the nostrils, okay? Making sure that there's no lesions, discharge, bleeding, lumps, bumps, or any lesions in there, that the nares are patent. And then I'm gonna ask her to include one nostril for me. Breathe in, breathe out. Okay, do the other side for me. Breathe in, breathe out. Okay. From here, I'm gonna have a smell. I'm gonna bring the smell over to her. Can you tell me what you smell?
Chocolate.
Okay, which is correct. Put it back in. Cranial nerve 1, olfactory is intact. From here, I move on to cranial nerve 2, which is gonna be optic. And to test this, first I'm gonna be looking at her conjunctiva. So I'm pulling down her eyelids, seeing that the conjunctiva is pink and moist. I'm looking at the sclera. Sclera is white. Okay. From here, I'm looking at her pupil size. It's gonna be a 3. Okay, which is normal. And then we are going to begin with a test. I'm gonna have her read my badge. What do you?
Darby Lipka.
And look at something in the distance. Can you read that sign over there?
Plant 80.
Okay. Cranial nerve 2, optic is intact. From here, we're going to move on to 3, 4, and 6. 3 being oculomotor, 4 being trochlear, 6 being abducens. So to do this, I would first have her start by looking at my pen light. You're going to follow it to move your head. So it's coming out, and it's coming in and down. Okay, she followed it correctly. From here, I'm going to have her doing her EOMs. So just move your head, just follow my pen light. So I'm going to go up. There we go. Back. Okay. And then from here, I'm going to shine my light in your eyes. It's going to be bright real quick. So once without my hands, just look. Okay. Go down. Other side. Okay. And now I'm going to do it like this so I can see the other eye. Okay. One more time. Okay. So Perla is intact. People should equal. Brown reacted to life, accommodation, and they're consensual and brisk. From here, we're moving on to cranial nerve 5, which is going to be trigeminal. And I'm going to first inspect her face. So I'm going to have you just look at me and touch it real quick. Nothing hurts?
No.
Okay. Can you bite down for me real quick? Okay. You don't have TMJ, do you?
No.
Any trouble when you eat?
No.
Okay. I forgot to actually do this. You don't wear contacts or glasses, right?
No.
Okay. So from here, I'm gonna have her close her eyes. I'm gonna touch her face, and you're gonna tell me where I'm touching on your face. Okay? So close your eyes real quick.
Cheek. Nose. Forehead.
Okay. So cranial nerve 5, trigeminal is intact. From here, I move on to 7, which is gonna be facial. I'm gonna have you make some facial expressions for me. Okay? So you're gonna puff your cheeks, smile, act surprised, and frown. Okay, so cranial nerve 7, facial is intact. From here, we're gonna go 8, which would be acoustic. For acoustic, I'm gonna palpate around your ears. So no pain.
No.
You have any hearing problems lately?
No.
You don't wear any hearing aids?
No.
Okay, so now I'm gonna inspect your ears. Looking for extra cerumen, any discharge, any bleeding, lumps, bumps, or lesions. There's none in either ear. So for this next test, I'm gonna whisper behind your ear. I'm gonna hold. Can you hold your right ear? Okay. Just real quick.
Watermelon.
Okay. The other side.
Lunchbox.
Okay. So we're gonna nerve 8. Acoustic is intact. From here, we're gonna move on to 9, which is gonna be glossopharyngeal. I'm gonna have you open your palate for me. Open your mouth. I'm sorry. So I'm gonna look inside. Okay. Palate's pink and moist. Soft palate are intact. Teeth are normal. There's no sign of dental caries. There's no bleeding. There's no discharge. Okay. So now I'm gonna find your trachea. Can you say ah for me? Can you swallow for me? Cranial nerve 9 is intact. Okay. So for cranial nerve 10, which is gonna be vagus, I'm gonna have her open her mouth one more time. I'm looking for a uvula. Make sure it's midline. I want you to say ah for me. Okay. Cranial nerve 10 is intact. We're gonna move on to cranial nerve 12 before we do 11. So cranial nerve 12 is hypoglossal, and it's gonna be her tongue movements. So I'm gonna ask her to open her mouth one more time. I want you to move your tongue side to side, up and down. Hold it up for a second so I can see your frenulum. Little, I can't see. Okay, her frenulum is intact, and her tongue movements are in sync. So cranial nerve 12 is intact. So from here, we're gonna move on to 11, which is gonna be your shoulders. And we're going to test your shoulder strength and your ability. Have you had any shoulder pain lately? Okay. So can you shrug up? Okay. Can you move your head to my side? Okay. Move your head to the other side. One more time. Okay. Shoulder strength is intact. So cranial nerve 11 is intact. So all of our cranial nerves are normal, and there's no abnormalities noted with any of them. So from here, we're moving on to the neck. I'll begin by inspecting the neck, making sure that there's no bruising, there's no JVD noted. I would shine a pen light each side. If you were in a bed that could move, I'd probably raise her up and down, try to see if the JVD would come out either side. Everything's good. I would get her pulse, both sides, her carotid pulse. Okay, +2 bilaterally. It's strong, regular. From here, I'm gonna auscultate for a carotid brewery. So, put it in. Using the Belda stethoscope. Take a deep breath. Okay. And she's negative for a carotid brewery. Okay. So from here, we're going to be doing lung sounds. So have you had any trouble breathing lately?
No.
No, like deep breathing, shallow breaths, something like that? Okay. So I will begin by doing lung sounds on the front. We will start using the diaphragm of the stethoscope right above the clavicle side. It's going to be vesicular sounds. Okay, take a deep breath. Okay, and we go another intercostal space down. Take a deep breath for me. Okay, over here. Okay, hold on. There we go. Then to the fourth intercostal space. Breathe. And over again. You breathe. Okay, then we go down to the 6. So you right here. You breathe for me. And the sun. You breathe for me. Okay, then we go one more side. This over here. Breathe in. One more time over here. Breathe in. Okay, now we do your back. Just flip around for me for a second. Start up top, clavicle, vesicular sounds. Breathe in. Over here. Breathe in. Okay, now we do a bronchovesicular, straight down the back. Breathe in. Breathe in. In. Breathe in. Breathe in. Breathe in. And last one. Breathe in. Right here. Breathe. Okay, so no adventitious lung sounds for noting. From while we still have you on your side, I would check for chest expansion. Okay, breathe in, breathe out. Okay, chest expansion is normal. Abdominality there. And also while I'm on the side, I'll be checking for EP diameter. So just check this like right here. Come across, and it's less than half the transverse. So her AP diameter is normal, and she's not barrel chested. Move back over here. From here, we're going to be moving to your heart sounds, okay? So I'm gonna be putting my stethoscope back on. Okay. And it's using the diaphragm. You don't have a pacemaker or anything like that. You don't have any heart problems that I should know about.
No.
Nothing. Okay. So we start on the aortic, which is going to be the second intercostal space on the right side. Okay. The pulmonic, which is going to be the second intercostal space on the left side. Okay. And then we go Eris point, which is third intercostal space. Okay. Tricuspid, which is going to be the fourth intercostal space. Okay, and then the mitral, which I would hold, which is also the apical pulse. I'm going to hold it for 1 minute. The point of maximum impulse. Okay. Heart sounds are normal. There's no signs of any abnormalities such as murmurs. And this is it. So from here, I would have her lay down her abdomen. Okay. So I would have her first start, and I would expect the stomach, making sure that there are no abnormalities noted, that there's not any bumps, lesions, stomach distension. I would also ask her while I'm down here, have you had a recent bowel movement?
No.
Okay. No. Have you had one today? Is that normal for you?
Yes.
Okay. Everything's fine with your eating patterns, with your digestion? Okay.
Yes.
So then after that, I would begin by auscultating. We would be going to the left lower first and going up to the left. So be holding this for a minute, looking for bowel sounds between 5 and 35, which would be normal. Anything above 35 is hyperactive. Anything below 35 is anything below 5 is hypoactive. And if I couldn't hear any within a minute, I would do it for 5 minutes after this. So we go left lower, left upper, right upper, and right lower. And this would be normal for her. Bowel sounds would be between 5 and 35. From here, I'm also going to check the aortic bruit, the abdominal aorta. So with my diaphragm, I'm going to be going between the xiphoid process and the umbilicus, which would be right here. Breathe in. And there'd be no bruit noted. Okay, so while I'm also down here, I'm going to be asking her about her genital urinary, but for the sake of this, we won't be checking any of this. So everything is okay with your menstrual cycle.
Yes.
Everything down there is okay, right?
Yes.
Okay, so move on from there. From here, we go into the extremities. So you can sit back up for this. Almost done. This physical assessment's almost over. You've been such a great patient. So I would for your extremities. So you can sit right here.
No, lower extremity.
Oh yeah, but we're gonna do upper first. Okay, so while I'm in the upper, I'm checking the inspection first. Oh, actually, we'll go back 1 second. We're gonna let you back down. I'm gonna palpate her abdomen real quick to make sure that there is no distension. And there's nothing. Okay, so now we want the extremities. So while we're here, I'm expecting the arms, checking for temperature, making sure they're both warm and the one's not colder than the other. I'm gonna be checking cap refill as well. Can you turn your Okay, +3, or less than 3 seconds, so cap refill's okay. I would also check the pulses. So I'm checking her radial pulse. Okay, +2, and her radial pulse. +2. Okay, do you have any problems with arm weakness, range of motion lately? Nothing? No. Okay, so I would run her through a couple range of motion tests. So I'm gonna have you put your arms out. Okay, then flip them. Okay, well, you flip them the other side. Okay, now bring them in, bring them out. Okay, so now I'm gonna do some strength. So squeeze my hands real quick. Okay, push them down, push them up, push them in, push them out. There we go. Okay, so strength is bilateral, it's normal. Her range of motions are bilateral, they're both normal. And there is no abnormalities noted within her upper extremities. So from here, we move on to her lower extremities. So I'm expecting, making sure that they're just like her upper extremities, so there are no lumps, bumps, bruises, or lesions. Let's see, nothing. Okay, I'm looking for color. Color's normal. Just looking for temperature. Temperature's both warm in both legs. You've had any problems with your mobility with your gait.
No.
Okay. So she tells me everything's normal with that. Checking cap refill while I'm down here. Okay. Less than 3 seconds each side. I'm gonna be checking her pulses, her pulsatile, dorsalis pedis, and anterior tibialis, or posterior tibialis. Okay. They are all +2. So from here, I'll be moving on to the range of motion. So I'm gonna have you bring your knees to your chest, like this. Both knees. You do it synchronously. No, but like, like this. Both knees. There you go, good patient. Thank you. Okay, you brought them back down. Can you pull them out? Put them in. Okay. So I'm gonna have you push down on my hands. Okay, push up, push in, and push out. Okay. So everything is good with her strength, mobility, and her range of motion. From here, I'm gonna test the overall sensation of the extremities, which I didn't test with the uppers. So I'm gonna go back to the upper. I'm gonna have you close your eyes, and I'm gonna touch one of the other sides. You're gonna tell me where I touched you at, okay?
Oh, I mean, left.
Oh, okay, left.
Right.
Okay.
Right. Left. Left.
Perfect. So her sensation in both her extremities are okay and perfect. So we are moving on to our last part of our examination, which is going to be the backside. So I'm going to have her flip over, I'll move to her side lying. From here, I'm inspecting the back and also the legs. I'm looking for the pressure points to make sure that there has been no pressure injuries developed as she's been in the hospital stay. So, I'm inspecting the scapula, the back of the neck, the spine, and definitely the sacrum. So, from what I see, there are no signs of pressure injury. Everything's okay. While I'm also back here, I'm looking at the back, making sure that there's just no scoliosis noted, and that there are no deviations with her scapula and her iliac crest, which there are none. So, from here, I would move on to the last part, which is when I would grab my gloves, and we would inspect the anus area, making sure that there's no discharge, blood, lumps, bumps, or lesions noted in the area, and there would be none. Everything checked out okay, and then we would finish our physical assessment. I would turn her back around. You've been such a great patient today. Thanks for letting me have a physical assessment with you. I'm gonna give you your call light. Call me if you need anything. Okay, I'm just be outside the door. Can I get you anything before I go?
No, thank you.
Okay.
Hi, Professor Philippos.